Question 2. Who needs bariatric surgery? Do I qualify for bariatric surgery? The indication for bariatric surgery is in a particular group of patients with severe obesity and obesity-related complications. So, how do we objectively measure who needs bariatric surgery? We use a simple parameter called BMI, body mass index. So, this body mass index is a parameter which is calculated based on your weight and height. So, body mass index more than 25 is overweight, more than 30 is obese, and when your body mass index crosses more than 32.5 with obesity related comorbidities. Obesity related comorbidities means obesity related problems. The common obesity related problems are diabetes, hypertension, fatty liver, then the obstructive sleep apnea, heavy snoring and obstructive sleep apnea, breathing difficulties, knee pains, high cholesterol. So when you have these kind of obese 32.5 BMI with these obesity related complications, or 37.5 BMI, even once you are 37.5, even if you don't have these obesity related complications, you qualify for bariatric surgery. So in addition, in Indian males, the central obesity, especially the males, the central obesity is a very big problem. So irrespective of your BMI, if your waist circumference is more than 100 centimeters, even then you qualify for bariatric surgery. And particularly in patients with type 2 diabetes, if you have uncontrolled sugars with very poor sugar control and high insulin requirement. So the problem when you have very poor sugar control and high insulin requirement is that over a period of 10-15 years, you're going to inevitably end up with kidney failure, heart problems, nerve problems, and leg ulcers and all those problems. So in patients with uncontrolled diabetes, if your BMI is more than 27.5, also the diabetic associations recommend that bariatric surgery is required. So essentially, bariatric surgery we do for patients with morbid obesity, BMI more than 37.5 or BMI more than 32.5 with obesity related comorbidities, or in patients with uncontrolled diabetes with BMI more than 27.5. So why do we call these BMIs morbidly obese? There are three reasons for that. One is, once you are a morbidly obese person, let's say you at 35 you're a morbidly obese person and a person of your same age who is of a normal weight. Compared to that normal weight person, a morbidly obese person, the life expectancy, the lifespan is reduced by 10 to 15 years. The reason why this happens is again because of these problems, the morbidly obesity contributing to your uncontrolled diabetes, your hypertension, risk of coronary artery disease, risk of stroke, respiratory problems, liver problems, all those issues. So because of all these problems, cancer risk, because of all these problems, the life expectancy is reduced, and at that particular BMI, 32.5 with obesity related problems or 37.5 by the morbidly obese definition, because of these obesity related serious health hazards, your life expectancy is shortened. So at this point, obesity becomes a serious health problem and it's called morbid obesity. So these patients, you need bariatric surgery. The other impact the morbid obesity has on the quality of life. How does morbid obesity affect your quality of life is, basically, once you're a morbidly obese person, the way you go about your life, the way you enjoy your life, the way you live your life is affected. Because if you have breathing problems, you can't walk fast, you can't climb stairs, you can't fit into narrow chairs. There are the self-esteem issues, the social issues of people mocking and finding a life partner and those kind of issues. And then you have issues like in the long run, knee problems, knee pain, back pain, and all those problems. Obstructive sleep apnea affects the quality of sleep, and many times these obese patients, they have, they keep going to sleep in the mornings, narcolepsy they call it. And so all these, for minor infections, as the obesity gets as the age advances, even patients with obstructive sleep apnea, your heart the right side of your heart becomes very weak. So even minor hospital problems, you have to keep getting admitted into the hospital. So in addition to the quantity of life, the life expectancy, morbid obese patients have a significantly poorer quality of life, and therefore these patients need bariatric surgery. The third major significance of morbidly obese is that it is scientifically proven that patients with morbid obesity cannot lose weight by diet and exercise alone. This is because everyone has a metabolic set point. So you have patients, young patients or older patients who eat a lot of food and they remain like reed thin, very thin for their entire lifetime. And then you have patients, a lot of obese patients who say that, doc, I don't really eat much. I eat normal quantities of food, but I keep on putting on weight. Why does this happen? This is because of your body's metabolic set point. The metabolic set point, your basal metabolic rate is different in different individuals. So the patients with endomorphic appetites, the first group of thin patients are called ectomorphs. Whatever they eat, they remain thin. While these obese patients, they are called endomorphs. So these endomorphs, because the metabolic set point is adjusted, altered, even if they eat less, they don't tend to lose weight. So it's not as simple as eat less and exercise more. Once you reach a certain degree of obesity, like 37.5, you may do your exercises, you may do your keto diets, you may do intermittent fasting and all that, and temporarily you may have some weight loss of 10-15 kilos, you may have temporary weight loss, but because your metabolic set point is readjusted, you tend to regain weight. So it is proven after a lot of research that patients in this morbidly obese group, the sustained weight loss is not possible in them by diet and exercise alone. So for these three main reasons, one is the life expectancy is short, number two is that the quality of life is significantly impaired, and number three is that these morbidly obese patients don't have sustained weight loss with your traditional diet and exercise, because the major component, the basal metabolic rate set point, is altered in these patients. For this reasons, the patients with morbid obesity, BMI more than 35, 32.5 and BMI more than 37.5 and 32.5 with comorbidities, in these patients, bariatric surgery is indicated.